Assalamualaikum and hi. My name is Catherine Nurkhalida binti Hasrul Nizam.
My name is Nur Ashran Shafiqah binti Zainal Abidin.
My name is Nur Rafida binti Muhammad Zazli.
And we are from Hospital Kampar. And today we're going to show you the projections for the elbow joint. So let's go. Now I'll be explaining about the indications required for an elbow x-ray. So the first one is bony injuries such as fractures or dislocations. Next is deformity, and it could also be inability to move the elbow or to check healing after a fracture is set.
For the cassette, we're supposed to use 1012, but in here, Hospital Kampar, we use 1470 because we're modern and we use VR, okay? This one. For VR, we use only one cassette, which is 1470, and the image will appear right here in this computer. Like this. Yes.
Now I'll be explaining about the patient care before an X-ray examination. Firstly, make sure you explain to the patient about the exam to ensure the patient is comfortable. For a female patient, make sure to provide them some privacy. Next, for all patients, help them to stand up. And for children, let a parent accompany them but give them a lead gown. Lastly, talk with patient using a low tone to respect the patient.
Your name is Catherine Nurkhalida binti Hasrul Nizam. Yes. The last four digit of your IC are 0002. Yes. When was the last time your period came? Last week. Okay. Can you remove your watch?
Now I'll be explaining about the patient care during an X-ray examination. Firstly, position the patient without causing them any harm. Secondly, provide radiation protection during the examination such as gonal shield. Lastly, collimate the X-ray beam to the area of interest only to avoid extra radiation exposure to the patient. Now I'll be explaining about the patient care after an X-ray examination. Firstly, inform the patient that the X-ray is over. Then ask them to change clothes. Next, you can accompany the patient until the entrance door and tell the patient to meet the doctor so the patient does not wait. Lastly, inform the patient to not leave any of their belongings behind. Go and meet the doctor back. So now I'll be explaining for the AP projection. First, you place the cassette longitudinal on the X-ray table. The patient is seated on the chair. The forearm is then extended and placed supinated. Ensure the shoulder is lowered to the level of the elbow by adjusting the table or the position of the patient. Both medial and lateral epicondyles of humerus are equidistant from surface of cassette. And lastly, place the marker in the right position and included in the collimation field. So for now, we will do the lateral projection. So turn it, okay. The forearm must be flexed at the elbow joint and the hand should be in lateral position. The elbow joint is the center of cassette and the tube must be vertical. The central ray is directed to 4 cm and is medially to palpable posterior surface of the olecranon process. For the conclusion, the elbow X-ray is a really simple procedure that can be done in a really short time. It is critical to position the patient properly and for them to stay still to avoid distortion in radiograph. At the same time, don't forget to apply the correct radiation protection.